Hi, and welcome to Hot on Health and Beauty, the show dedicated to helping you create the new you. I'm your host, Brooke Lane. Today's show is chock full of great information about how to improve your health and your physical well-being. So let's get started. Dr. Richard Ha is a board-certified plastic surgeon with the Dallas Plastic Surgery Institute. He performs both cosmetic and reconstructive surgeries and begins each patient relationship with compassion and respect. Ask any one of Dr. Richard Ha's patients and they'll tell you that he's passionate, meticulous, and honest. Many of them come to him for advice on how to address a tired, weary look.
When women come in to me saying that they're tired looking, I think that that's not always exactly what they're complaining of. They just don't know exactly how to classify that. They just don't like the way they look in this area of the face. Some of it is because of gravity. The eyebrows are descending, the cheeks are falling off their face, you know, they've got jowls. But some of it may be just because of the what we call animation lines, or lines created by the muscles in the face from years of contracting in a very repeated and similar fashion. Those classic lines are located in the forehead and around the eyes. The other thing that we notice with aging is that we lose volume, we lose fullness in our face. And typically that happens in very characteristic locations. So how I address this look of being tired is really multifactorial.
Depending on your age and skin quality, Dr. Ha says the treatment plan can vary from Botox injections to a full face, neck, eye, and brow lift, along with laser resurfacing and fillers, like Christy Barrier.
I feel years younger. I even have more energy. It's just so strange how just a look can make you feel so much better. And I have 4 grandchildren, and I've had several people tell me, you just look totally awesome. We just cannot believe it. Said, we thought you were beautiful before, but wow, look at you now.
And then there's patient Connie.
She came to me saying, you know, I look tired. And if you look at her pictures, you can see that, yes, indeed, her brows are low. They're crowding her upper eyelids. The wrinkles that you see around the corners of her eyes are also another indication. If you look closely on her forehead, she also has some early permanent creases from always constantly having to subconsciously elevate her brows to clear the extra skin in her upper eyelid. If you look at this patient's lower jaw, you can start to see that the cheek is starting to fall off it, and that's what we call a jowl. And so what this patient really needs is a comprehensive approach for the rejuvenation. All of these elements that I've mentioned are contributing to this look of being tired. It's an upper face thing, it's a lower face thing. She underwent a complete facelift with a neck lift as well, a brow lift, which helps relieve that crowding, an upper eyelid conservative skin excision to just help clean up the extra skin and get a nice smooth crease. She also had the 3-component lower eyelid surgery that I typically perform. It really helps smooth the lower eyelid and its transition.
I was absolutely thrilled. There was no looking back. If I ever start sagging again, I'll do it again. So it was a very easy process.
It is the best thing that I have ever done for myself. I have not regretted it at all. I wish I had done it years earlier.
When you look in the mirror and see that you feel on the outside like you do on the inside, it's refreshing.
The stakes are a little bit different and the expectations are different, but ultimately in the end, my patient's happiness is everything to me.
Our next physician says there is not a one-size-fits-all procedure for breast enhancement surgery. The implant type and size, even the location of the incision, are all customized decisions. Meet Dr. Richard Ha. Dr. Richard Ha is one of the elite surgeons with the Dallas Plastic Surgery Institute. Ha says the decision to have breast enhancement surgery is a very personal and sometimes emotional topic for women.
Dr. Ha spent a lot of time with me. He made sure that I felt comfortable with him. It's been the best thing I've ever done for myself.
It's not always just about making breasts larger. Some of their concerns about shape, asymmetries, which are very common in women. Breast asymmetries probably run greater than 80–90% in most women. And it also may be just the shape. Some women who have had pregnancies have enjoyed larger breasts during their pregnancy, and then experience deflation afterwards. So it's a combination of factors, and all of them interrelate into their self-awareness of their breasts and ultimately their self-esteem as it regards to that.
According to Dr. Ha, there are lots of options available when it comes to breast enhancement surgery, so it's important to do your homework.
For example, you have varying types of implants of different sizes, shell textures or characteristics, as well as shapes. The implants can be placed above or below the muscle of the chest, the pectoralis muscle, and they can be inserted through a variety of approaches. You may have heard of the transaxillary approach or through the armpit. There's a periareolar, an incision around the nipple, and then an inframammary fold incision, which is located obviously in the underfold of the breast tissue. And then there's also the type of implant itself. There's saline options, and now there's silicone options, which has been a very recent change, and one that is very welcome, because I think that for women it's about choice, about having the flexibility of having a variety of options. I think that the most important thing is to talk about what my patient's expectations are. And then, obviously, do an examination, look at the anatomy, look at the tissue characteristics, understand what my patient's goals are, and try to find a solution that'll encompass both of them in the best way possible.
I'm very happy with it. A lot of people can't even tell that they're implants, and I love that. I've had no problem sending my friends and family to Dr. Hall.
You get quite a few patients who have regained what they may have once lost, or may have been able to enhance the breast in ways they've never dreamed possible, and the satisfaction that they have is just incredible, and it's just a very rewarding experience for me.
When it comes to earrings, the bigger the better, says Paula DeLong. But her love of dangly, sparkling jewelry has caused her earlobe to tear.
It just looks bad, like when I'm out, you can see the hole pulling down and everyone notices it.
At first, patients with tears like Paula's are told to simply stop wearing their earrings to let the lobe heal on its own. But that often doesn't work.
Just removing the earring oftentimes does not allow the hole to close, because that has become a mature tract.
Paula is now hoping Dr. Ha can help.
Fortunately, there's a relatively simple solution.
It's becoming more and more popular, say plastic surgeons, for patients to get their earlobes surgically repaired.
It's a pretty simple procedure, actually. It probably takes about 30 minutes to an hour in the office under local anesthesia.
After the tear is fixed, it will need several weeks to completely heal. So around 6 months and a few $100s later, Paula will have a piercing that's as good as new.
I know it doesn't seem like a big deal to maybe a lot of people, but it does to me.
Those feel very nicely.
With a job in public relations, Daniel Cooper says it was his career that first got him thinking about cosmetic surgery.
I realized that my own self-image, what was put out there in the public, was very important to me, and I wanted to look good at all times.
Men tend to come in and they have a couple of reasons why they want to undergo plastic surgery. One is that they may want to look more youthful, to be more competitive in the workforce.
Competition at work, plus quicker, cheaper, less invasive techniques, seem to be driving a trend. In just the past 5 years, cosmetic procedures in men have gone up 44%. Baylor plastic surgeon Dr. Richard Ha believes the numbers also have a lot to do with society's new acceptance of not just women, but now men going under the knife for good looks.
I think men have become more aware that, hey, I can take care of myself in the same way that women do. I can look better and thus feel better.
He filled that in and straightened my nose.
Daniel, who underwent procedures to pin back his ears, reshape his nose, and eliminate the bags from his eyes, says he now wishes he had done it years ago.
I think if anybody can do anything to make themselves feel better, they should do it.
In the body here, okay?
Okay.
55-year-old Elise Pruitt says people are usually surprised to hear her age.
They're always shocked. They always think I'm 35, maybe 40.
So what's her secret? Elise says it's regular maintenance. She's in today to get one of the newest age-defying treatments available, an injectable filler called Radiesse.
I think that this is a nice way, an injectable way not without aggressive surgery, to be able to provide good correction of these wrinkles.
Radiesse is made of tiny synthetic calcium spheres that not only work to plump skin, but actually encourage new collagen growth. Experts say it's especially good on deeper wrinkles.
This filler is really made for that. This is injected just beneath the level of the skin and can really help essentially lift up the valley of that wrinkle.
The real advantage, while other injectable fillers last on average 6 to 9 months, Radiesse lasts for up to 2 years.
It's certainly easier on the pocketbook. It's also less of a hassle. Every time you undergo a procedure, there are some inherent risks to it.
About an hour and around $1,000 later, Elise hopes the tiny lines around her mouth will be as unrecognizable as her true age.
If it lasts a year or lasts longer, that's a good investment. Real good investment.
For Baylor Healthcare System, I'm Dr. David Winter.
Dr. Richard Hall with the Dallas Plastic Surgery Institute says a rhinoplasty, or nose job, is one of the most complex procedures in plastic surgery. But if done properly, it can be one of the most rewarding for the patient.
I didn't like profile pictures at all. Don't even attempt to take my picture with the profile. I had some issues with my nose. It had been broken a few times. It had a lump on the top, and the cartilage ended up causing the front to fall.
For patients like Rachel Rees, a small improvement to the shape of the nose can make a big difference to the overall look and appearance of the face.
Now, Rachel had an element of nasal airway obstruction, and so part of my surgical plan was to straighten the septum. She also had a hump, if you look on the side of the nose, that she didn't like, and wanted to have her tip rotated up and refined just slightly. And we were able to accomplish that, and she's extremely pleased with the shape of her nose.
I have recommended him to so many people, and I have had people notice the difference in my personal appearance and actually wanted to come to see Dr. Haw specifically because of what a great job he did.
When we talk about nasal reshaping or rhinoplasty, I really take a very personalized and individualized approach because it's hard to give somebody else's nose.
This patient came to Dr. Haw for corrections to a previous nose surgery performed by another physician.
Daniel had a previous rhinoplasty that created some changes that he wasn't pleased with. His nostrils were a little bit uneven. His tip and his entire nose was really deviated off to the right side.
Dr. Haw also recommended a chin implant. He says the chin, lip, and nose all work together for a proper aesthetic.
You can see on the postoperative results here, just a moderate-sized chin implant really has changed the entire physique of his face, if you will. His jawline is stronger, his neck angle looks sharper, and his nose looks more balanced on his face. So I think a successful rhinoplasty is not just about meeting your patient's expectations, but it's about the attention to detail and the intricacy of the operation. And I certainly welcome that challenge and have a passion for this type of operation. I love it. It really puts plastic surgeon skills to the test. Most rhinoplasty surgeons are ultimately lifetime students of the operation. We're constantly trying to strive to find better ways of doing what we do.
I don't think I would have been near as pleased with the results or the experience if it wasn't for Dr. Haw.
After pregnancy or significant weight loss, many people are disappointed to find that no amount of diet and exercise can repair stretch marks or excess skin. Instead, the solution is oftentimes found in a procedure called an abdominoplasty, otherwise known as a tummy tuck. Here's more.
I have two boys, 18 and 13, and I had C-sections. So I had this just kind of where they cut, I had this just roll of skin that no matter what I did, I couldn't get rid of. But I just found Dr. Haw and went in for consultation and talked to him. Basically, I wanted to just know if it was something that I could get rid of, if I was just being lazy or did something wrong. And he pretty much let me know that no matter what I did, that little type of skin really wasn't going anywhere.
Childbirth is one of the most incredible experiences a woman can have in her lifetime. But the reality is that pregnancy can also wreak havoc on a woman's body.
It's a time of tremendous physiologic changes. You know, women are sometimes adding 50 up to 50% of their body weight during pregnancy. It is in the belly area where you've got tremendous stretch of the skin, the muscles of the stomach wall, what we call the abdomen, and the fat around it.
Many of these issues cannot be addressed with diet and exercise, so Dr. Ha performs a procedure called an abdominoplasty, also known as the tummy tuck.
There are a couple different variations. There's the classic tummy tuck, which involves a lengthier scar, essentially extending from hip to hip, going down into the lower abdomen. That involves what we call a muscle plication, or a tightening of the abs. Those are the paired muscles of the abdominal wall. And that is really the procedure, or the tightening of those muscles, that allows you to get that straight and sometimes washboard-looking stomach again. There's a procedure out there called a mini tummy tuck, and that's a variation of this, where you've got a shorter scar, but you're more limited in the amount of skin that you can take off. You can do this muscle plication with or without this mini tummy tuck, but it's generally a little bit more limited effect. Fewer women are really candidates for this. The other thing that's a difference between a mini tummy tuck and a full tummy tuck is what happens to the belly button. In a full tummy tuck, the belly button is actually cut around it and then resited in the new skin after being pulled down. Whereas in the mini tummy tuck, nothing is really done to the belly button. It stays in its normal location. It may be pulled by virtue of the skin pull, but no incisions are made around it.
I personally have compared scars with other women, and mine by far was better than theirs. Perfect. My scars healed perfect. It's perfectly straight. You can almost not even see them, and it's only been like 2.5 months.
Some women feel like that this is their reward for undergoing the trials and tribulations of their pregnancies, and